And joining me now from Montreal is Avi Finegold. He's the host of the Bonjour Chai podcast, which is our sister podcast at the CJN. It's a weekly current affairs show. And Avi's been at the Montreal site where the Hasidic community has been holding vaccination clinics. And he joins me now. Avi, welcome to the CJN Daily.
Crossover episode.
Crossover episode. You got it. Listen, first of all, tell us where exactly you are in Montreal and what is there behind you? What's going on?
So I'm basically at ground central of both Mile End, which is the Hasidic, the hipster community, and Outremont, right, the Hasidic community. You'll see Hasidim passing by. You'll see people of all sorts of hair colors and shapes and sizes going on. This is really the corner where everything happens. There's a synagogue right here, and it's the site of a vaccination clinic here today. That Sam Muller, who's part of the Hasidic board of Hasidic relations with Quebec, has been organizing to get the Hasidic community vaccinated.
Okay, so this particular one is only a one-day thing, or it's been open for a while?
This one has been around only for today, but he's been doing, as he said, countless, more than he's able to count.
Okay, so you got to go in. We were permitted by the Quebec Health Department to go in. Tell us what you saw. Describe what's going on in there.
There's a steady stream of Hasidim going, and there's actually an interesting study that's happening at the same time, looking at the Hasidic community and COVID. But it looks like any other COVID clinic that I've been in or seen, and I've seen at least two, and for my first and second shots. And there are people, it's a steady stream of people walking in, getting vaccinated, waiting their 15 minutes and leaving. There's little kids accompanying their parents. There are older people, younger people, but almost exclusively within the Hasidic community.
Now, what are the differences in terms of the protocol because they are Orthodox Jews? Is there anything like women on one side, men on the other?
Nope, absolutely not.
Who?
Everybody is recognizing that this is a healthcare guidelines, and you're just getting vaccinated by whoever's getting vaccinated, and and that's it.
Okay, so you had a chance to speak to Sam Muller, who is on the Quebec Board of Hasids, Hasidic Community for Council of Quebec. What was the gist of that conversation?
Well, he said that if the community recognized that there is the need to get vaccinated. Most people really know that getting vaccinated is important. A lot of them were getting it done earlier. Within the CLSC, the Click Santé system, in whatever clinics were around. And he just said that, he was trying to make these clinics available to make it as open as possible for anybody to remove as many barriers as possible. And that this is the thing that the community is doing to be able to say, we want to get as many people as possible vaccinated. And if it takes some time having clinics exclusively for the Hasidic community, then he's going to go and do those as many as possible.
So to borrow an inappropriate metaphor, bringing the mountain to Muhammad, as opposed to making them go to a secular, non-religious place where they may not feel comfortable.
Absolutely, but he was very emphatic about the fact that many Hasidim had no problem going to the regular clinics at the University of Montreal or at the hospitals for getting their, already since Passover, he said that there were many people getting vaccinated as soon as they were available and going to get vaccinated in regular clinics. But for some people, this is available.
So what did he say about the fact that in the news and public perception of the Hasidic community as being slow or even reluctant to follow the health rules during COVID and the public perception that they're not with the program?
He didn't seem to think that it was any different than any other community, that there's a lot of different communities that have the same level of hesitation or protocol breaking. Off the record, I've spoken to people in the past, and they have told me that they just think that there was a lot of at the point when the vaccine was out and everybody had been vaccinated, and it wasn't fair that they had to keep these rules, and that they lost a lot of trust within the community. Of course, this isn't necessarily today, but this is in my conversations with members of the Hasidic community in general. But that they were starting to lose that trust. But he was very clear to say, in his opinion, people are following the rules, and not any more so. There's not nearly as much breakage as people say that there is, breakage of the rules, and that in reality, it's no different than any other community.
All right, interesting take from his point of view. Now, what did you hear when you interviewed the two patients? Describe them and tell us what they said.
So we had some young men and young women that were willing to talk to us. A lot of people aren't necessarily willing to go on the record to talk to people within, to be on the air. But a lot of people that are here finally are saying that they're basically getting vaccinated for travel. They're saying that, look, I either got sick already or I don't necessarily think that this is something that I need to be doing, but now I'm going to be extra, protected. And I want to be able to travel for the holidays, to go to the US, and vaccinations is really the easiest way to do it. So that's why they're doing it at this point.
So September 1st will give them, they won't be able to go for the Jewish New Year, but they could go for Yom Kippur or for the Sukkot or for other later on.
Or beyond. People travel back and forth a lot, right, to New York, right? Montreal, in the Hasidic community, Montreal is almost a satellite, a suburb of New York City. So they want to be able to travel back and forth with ease, and the vaccine will allow them to do that. For a lot of people, that was the case.
Now, you said a lot of people already had it. What did you make of, what did they tell you? Did the other person that you interviewed also have had COVID too?
I can't remember. One of them, I believe, had COVID, and one of them said that she was just, that was it. But the experience with a lot of people, when you ask people in the community, whether it was Sam or other people, they said a lot of my friends have had it. I have members of people that have passed away, or people that I knew, and it's very sad. But there was this perception that the immunity that you're given by getting sick is, by having COVID is there, and they need to be educated potentially also about the fact that getting the vaccine is still a very good idea, even if you've had, the virus already, and it's, you've gotten sick and you've recovered.
What else did these two patients tell you? Did they feel that pressure because of the fact that Quebec, as of September 1st, is mandating vaccine passports for many essential services or essential places to go, but not synagogues?
It wasn't really, I must say that it wasn't really brought up. There was no discussion of the passport anywhere. I didn't hear anybody really talking about it. I don't think that it's on a lot of people's radars in terms of getting the vaccine so that one can have a passport to use it. I do think that many of the people here are within their own communities and doing their own thing, and the passport isn't necessarily as relevant to them or in their minds as it is for other members of the general population.
Okay, so your impressions of being at the vaccine clinic, was there stigma, or was it friendly? Like, who was doing the vaccination? Was it other Hasidic people were doing the jobs?
No, members of secular people. This is the general community. These are the people that would be doing it in any other clinic. This is being run by the CLSCs, by Quebec, Health, and so that's all following what they have. I did see there are some volunteers that are helping people through, helping with the Yiddish to help them, if they're not so good with English, to get them through and to have them make sure that all the steps are followed and that they're getting everything done. I did see some people within the study outside the actual vaccination part itself that maybe, facilitated some of the people wanting to talk about what they were doing or having their experiences with the study, but that had nothing to do with the vaccination clinic itself.
Sounds like it was in a very interesting afternoon. Any last impressions you want to share with our readers? You were our eyes and ears.
I find what was interesting is that it seems more and more obvious that most people within the community have already been vaccinated, and these are really a lot of the people that whether they didn't have the time or they didn't feel that they needed to, but at this point travel is enough of an incentive to go and get this done. And that, I'm glad, in all honesty, but personally, I think it doesn't matter why you're getting a vaccine, get a vaccine, and to have the space available for people is, a great thing to have.
What about the fact that school is starting again in September for just private and public schools, religious and non-religious? Did that have anything were there any kids there getting vaccinated?
I didn't see any kids. I do think, and I'm not certain, but I do think that there, as regards to the kids in the schools, there is the vaccination buses, the vaccine vans that are going around to the schools to minimize the amount of time away from schools that is happening for the kids. I'd have to double check and make sure that that's what's going on within the Hasidic community. But I know, for example, within my own kids' schools, the kids that are eligible finally, they're arranging days with the vaccine van so that they can just pop out, for one period instead of having to take a day off to get a vaccine.
Sounds good. Avi, thanks so much for taking the time to do this for us, and wish you a happy new year.
Always a pleasure. And I hope that we'll keep the conversation going.